epidemiologist Dr. Ruth Winfield. We'll then open it up for questions from reporters on the line. With that, we'll now turn it over to Commissioner Malcolm.
Thank you, Mike, and good afternoon, everyone. Well, the United States yesterday recorded 219,000 more cases and 3,112 more deaths in a single day. It was also reported that there are now 109,000 Americans in the hospital at the same time, which is the highest number yet seen, and really underscores some of what we've been talking about just the fact that the whole country is having this surge at the same time, and the pressure that puts on the healthcare system in the whole nation, and the added challenge then of not being able to support each other regionally with surging healthcare resources into the regions that are having the greatest trouble. With a very different scenario than it was in the early days in the Northeast, and then in other regions as they had more localized surges. So that just is an added piece of the picture when we're looking at protecting healthcare capacity here in the upper Midwest and in Minnesota. In Minnesota, we added another 3,523 cases through a testing volume of just under 41,500. This brings us to a new total of 367,218 cases of COVID-19 in Minnesota since the start of the pandemic. And sadly, we had another day of a large number of deaths reported, 89 deaths reported yesterday. Again, one of our highest numbers, bringing our new total to 4,198 deaths. Yesterday's total included 37 deaths in the metropolitan area, 52 among residents of greater Minnesota. The total includes several people in their 20s, 40s, and 50s, as well, of course, as many people in their later decades. 56 of these deaths occurred in residents of long-term care facilities. There have been cumulatively a total of just over 19,000 patients hospitalized in Minnesota, and over 4,145 have received intensive care. There are currently 1,542 people currently in Minnesota hospitals with COVID-19, and as we've reported, our hospitals statewide are very full, not only with COVID patients, but with other important health conditions as well. 352 people statewide are in intensive care. With that, I've asked Dr. Linfield to join us today to give an update on what we know about the longer-term health impacts of COVID-19, and we will be available for your questions. So with that, I'll turn it over to you, Ruth.
Thank you very much, Commissioner. And indeed, these really are very sobering numbers, and I hope that people really do take the time to stop and think about them, that each of these represents a person, and the data from Minnesota, a Minnesotan, someone in our communities. I'd like to talk a bit about the impacts on health. Many people who are infected with COVID-19 do not have symptoms, and therefore some do not know they have it unless they get tested. This is estimated that about 50% of transmission can occur in people who are pre-symptomatic or asymptomatic. And so people who don't have symptoms can pass it along to others. And those others, of course, are people who may develop symptoms. Some people can have a relatively mild course, but there are people amongst our families, our friends, our communities who do have more serious illness. And these are represented in the numbers you've heard, the people who have had to be hospitalized, the people who've had to be in the intensive care unit, and sadly, the people who have died from COVID-19. However, we are learning more and more that in some situations, COVID-19 is not just an acute illness, that some people, including people who are hospitalized, but also including people who had a mild course, they can develop symptoms that can go on for weeks or months. We're still learning how common these symptoms may be. We're still trying to understand who is most likely to get them. Certainly there's a higher risk amongst those who had more severe disease, but in fact we're hearing more and more that people who have a mild illness do develop ongoing symptoms. And sometimes they develop new symptoms over the course of the following weeks that may last for months. These symptoms can include things like fatigue, shortness of breath, cough, joint pain, chest pain, difficulty with thinking and concentrating, and sometimes that's referred to as brain fog, memory difficulties, change in mood, the development of anxiety, muscle pain, headache, intermittent fever, a fast beating or a pounding heart, that's also known as heart palpitations. I have discussed with you in the past about the multi-system inflammatory syndrome in children, MIS-C, which we think is a COVID-related condition. I want to give you a bit of an update on that, but first, although it is a very concerning syndrome, and I will go into those details, I do want to remind you that it is a rare occurrence, and to date, we have had 43 cases reported to the Minnesota Department of Health out of more than 59,000 cases of COVID-19 in children in Minnesota. MIS-C, which stands for Multi-System Inflammatory Syndrome in children, is a condition where different parts of the body can become inflamed, including the heart, lungs, kidneys, brain, skin, eyes, or gastrointestinal tract. Children with MIS-C present with fever and various symptoms. Sometimes the fever occurs a few days before the onset of these various symptoms. A very common one is abdominal pain, decreased appetite, vomiting, diarrhea. There can be a rash that occurs in these children, redness in the eyes. There can be some swelling of the hands and feet. The children can feel very tired. There can be neck pain. All of the Minnesota children who developed MIS-C were hospitalized, and more than half required intensive care. So the reason we discuss it, even though it is a very rare syndrome, we are concerned. We don't want to see our children in the ICU. The other thing that we have noted about MIS-C that has also been noted on a national level is a very large disparity amongst the children in terms of their race and ethnicity. In Minnesota, 67% of our cases have been Black or Hispanic. This has also been seen on the national level, where up to 3/4 of cases have been in racial and ethnic minorities. 1,288 cases have been reported nationally as of December 4th, including 23 children who have died. We don't know everything we want to about MIS-C, but we do know that if we can limit the spread of COVID-19, we can limit this from occurring because we have more and more strong evidence of the association of COVID-19 with this syndrome. Interestingly, a similar syndrome has been seen in young adults, and we call it MISA. It is less commonly reported than the syndrome in children. At least 70 cases have been reported nationally, and we have had 2 cases in Minnesota. So I just want to circle back to just share that the, quote, long haulers, the individuals who have complications from COVID, the impact of this infection continues on, and it can continue on and cause complications even in people who did not have a very severe acute course. And this is something that we are very concerned about, and we really want everyone to work their hardest to limit the spread. This is not just a problem for the elderly, for our fellow Minnesotans who have medical conditions, but it is a problem for all of us, and all of us, I'm sure, are hearing about friends and relatives and colleagues who have had COVID, and some of who have gone on to have these lingering symptoms that really impact the quality of their life. So really, we want to work together with all of you, with all Minnesotans, to do what we can to prevent the spread. And until we have safe and effective vaccines, we really need to do everything we can to stop the transmission between fellow Minnesotans. We have to do our best to get our numbers down. We know this is hard. This is really, really hard. This pandemic has been going on for a long time. It is taking a big toll in so many areas of our lives. And it is hard for us as health officials too. But we have to hang in there, and we have to do the best we can. Thank you. At this point, I will turn it back to Mike.
Thank you, Dr. Linfield. Operator, we're ready to take questions.
Thank you. As a reminder, to ask a question, you'll need to press *1 on your telephone. To withdraw a question, press the # key. Again, that's *1 on your telephone. Your first question is from Dan Gunderson from Minnesota Public. Your line is open.
Hi. When we talk about long haulers, is there a diagnostic criteria for that? And do we have any idea how many there are in Minnesota?
Yeah, so this is a really important question. And the medical and public health community are starting to come up with ways to classify people who experience these symptoms, so we're all speaking the same language, and so that we can understand the data that we're collecting and the patients that we're treating. So there have been some proposed ways of classifying these individuals, and it hasn't totally been worked out. I do not have a sense of how many Minnesotans yet are experiencing this. There have been a number of surveys that have been conducted by the CDC, as well as by a number of different academic groups. There have been also some groups that have looked at follow-up both from hospitalized patients as well as trying to gather data on patients who were not hospitalized. And I know a number of the academic institutions in Minnesota are having some clinics where they are trying to follow individuals and collect the data. So I don't know yet. I have seen, large percentages that vary in the medical literature. And the ranges are pretty large, and many of these are single-center publications. I'm a little hesitant to guesstimate, and it depends a bit on whether you're following pulmonary, lung complications, shortness of breath, or are you following things like loss of taste and smell, which, as you know, can be a sign of acute COVID, and in some people it takes a while to respond. We are also seeing psychiatric complications in association with COVID. I mean, there really is a wide variety of complications, and so we are going to follow this closely, and I will give updates as we learn more.
And could I follow up there? If there are so many different symptoms that come out of this, is that going to make it difficult to develop treatment protocols?
It will. I suspect that protocols will focus on the specific treatment. So it is not common for someone to have, the full spectrum, but, if someone is having, say, lung complications, the sort of follow-up that you would do for that person clearly would be different than the follow-up that you might do with someone who has developed depression or anxiety.
Thanks.
Your next question is from Glenn Howard from Star Tribune. Your line is open.
n.edu/SW. It's not common.
Apologize, he disconnected his question. And your next question is from Steve Karnowski from Associated Press. Your line is open.
Yeah, hi. It's just I noticed in today's numbers, and the commissioner kind of alluded to this at the beginning of the briefing, but we had a couple people in their 20s die from COVID. Can you tell us anything about that, about how unusual that is?
Well, it definitely is unusual statistically, but as Ruth has just been saying, the full profile of COVID-19 and who it affects and how severely is quite a bit broader than what perhaps the narrative was at the beginning of the pandemic, that it was really just a matter of something that the elderly and people with significant underlying health conditions were most vulnerable to, which remains true statistically. But the point being that bad outcomes are happening to people across the age spectrum. In terms of these younger individuals, there were, in today's numbers, a couple of folks, as you note, in their 20s, a couple of people in their 40s, a couple in their 50s. So we are seeing increasing numbers in those younger age groups as well. I don't know the health history of the younger people. I don't know, Ruth, if you do.
Yeah. Generally, the younger people have a variety of health conditions. We do see that obesity, as well as diabetes and hypertension, come up a fair amount. But we all need to remember that these conditions are very common in our communities. And so it truly is of great concern that we're starting to see deaths and that we are seeing deaths, period, but that we are seeing deaths in younger individuals. And as you may recall, way back in the spring, we had a very high proportion, something like 84% of our deaths were folks who were in long-term care. And over the course of the pandemic, that number has dropped. I think we're more like 68% or something of that sort. But some of these deaths are occurring in people who live in private residences.
Thank you. Your next question is from Anthony Munson from KINT. Your line is open.
Hi there. I just wanted to follow up on Minnesota's decision not to share names and addresses of vaccine recipients with the CDC. Is there any concern that that could possibly hinder the CDC's efforts to collect that analytics and develop, a more bona fide distribution plan for Minnesotans?
Thanks for the question. This is Commissioner Malcolm. First, I'll just again clarify that the reason that we're not sharing individually identifiable data is because of Minnesota's data privacy laws concerning health information. So it wasn't a decision just made by the health department for whatever reason. It was a matter of state statute, and actually a number of states around the country had similar issues and similar concerns. So the CDC is well aware of the reasons for that and understands them, and has not expressed any concern that this will hamper their efforts in any way. They will be getting full aggregate information, that the data won't be personally, individually identified, but they'll be getting a wealth of detailed information on demographics and so forth.
Perfect. Thank you.
Again,
Operator, we have time. Yep, I was just going to say we have time for one more question.
Thank you, sir. Your next question is from Bill Werner from Minnesota News Network. Your line is open.
Yeah, thank you. This may be for Ms. Linfield or perhaps for the commissioner. The long-term kind of infections that maybe are not don't have serious acute symptoms in the acute phase, but then have other repercussions as we go on. Can you give Minnesotans any sort of idea of when they should be tested? In other words, say a person has a bit of asthma, and we have warm weather now, and you're getting a little bit of cough and sneeze and that kind of thing, those kind of symptoms, or any other possible symptoms that might be more traditionally associated with a cold or flu. Please help Minnesotans, give Minnesotans some guidance on if you got those kind of symptoms, should you be tested for COVID just as a matter of course? I'm trying to grasp, what kind of advice we should give to folks.
Yeah, thank you so much for that question. Yes, the symptoms of COVID really overlap those of other conditions. And so it is challenging if somebody develops new onset cough, even if they have asthma, to know whether that the asthma was induced by a viral infection such as SARS-CoV-2. And we have so much of this virus circulating in our communities that I recommend having a very low threshold that if you have a new symptom, you should be tested. If you have a known exposure to someone who has COVID, you should be tested. Our recommendation is to be tested about 5 to 7 days after that exposure. On our website, we do go into detail about the symptoms that are associated with COVID, and so people can read that there. I'd like to refer people to that, and we all need to have a very low threshold because if you do have COVID, we want you to isolate, and we want to be able to contact people who have been closely exposed to you so that they can quarantine, so we can get a hold of the amount of virus circulating in our communities. So I appreciate very much you're getting the word out on that.
Dr. Linfield, may I just do one quick follow-up? I know we got to end here, and that is for the long haulers, as they are called. In other words, they have an acute phase that is relatively mild, and then the symptoms progress into other areas, potentially based on a person's physiology, right? Okay.
Right.
When they get into the long haul phase, are they still potentially transmitters of COVID?
Yeah, no, that's a really great question. Thank you for that. Just to clarify, these we view more as complications, and that if a person has not had a severe case of COVID, in other words, if they haven't required hospitalization, or if they do not have an immunocompromising condition, we now have very good data. We have a lot of experience that they are not contagious after 10 days. And this is why we have 10 days for our period of asking people to isolate. We do know that COVID may set off some kind of an immune dysregulation, and that can be associated with some of these problems. We're still learning the mechanism. Just circling back, there are some people who we do ask to isolate a little bit longer because they might be contagious a little bit longer, and these are people who've had severe disease or people who are immunocompromised, and generally our recommendation is that they be isolated for 20 days after the onset of their acute symptoms, unless they can be tested, and if they have 2 negative tests, you may be able to end their period of isolation a little bit earlier than the 20 days. And if they have severe, really significant immunocompromise where their immune system doesn't work well, and there are a number of people who really have very, very fragile immune systems, there we really defer to the doctors taking care of them to determine when they're no longer infectious.
Thank you so much, Doctor.
Thank you.
Thank you to everyone for taking time this afternoon. We do say if you have any other questions afterward to reach out to our office, but we will plan to get back with you again soon. Thank you.
This has been a WDIO News Special Report.